Good evening, everyone, and thank you for the warm welcome. Once again, I am Araceli Lanorio of Philippine Alliance of Patient Organizations and Neurofibromatosis Friends Philippines. As a patient, we always knew that there are risks when taking drugs. Medicines can heal us when we are sick, ease our pain when we ache, and prevent or control our long-term conditions. But sometimes, even when they do the job they're supposed to, they have unwelcome side effects. Side effects can range from mild conditions, such as fatigue and constipation. Side effects can happen anytime. It may occur when a patient first take of medicine or a sudden change of dosage, or most of the time, by taking a non-prescribed medication. Unfortunately, as a patient, we cannot rule out side effects. But there are something can be done to suffer. Conversations about side effects are important. Patients who discuss on their physicians are less likely will prematurely discontinue the medication rather than to those who does not discuss. A patient must be knowledgeable about their medication. It is highly important that we don't hesitate asking our doctors if we continue or stop a certain medication if this is giving us discomfort. We should also ask our physician to explain further to us the details of the prescribed medication. As a patient, it is also important that we discuss our medication history. With this information, our physicians can prevent prescription errors. Accurate medication history are useful in detailing drug-related side effects. As a patient, we must also take health literacy in consideration. The value of knowing the right medication and treatment is our main concern. With this, we can bridge the gap between the patient and the physician. It can also increase our understanding in the relative side effects and tolerability. There are some instances that the patient are seldom asked about the personal impact of their own experience of the side effect of a medicines, or most of the time, the fear from the patient itself to inform the physicians of the side effect. Better understanding of the impact of the side effects and tolerability may help to identify certain side effects for a patient. We must increase our voice to let our physician to know that we are also concerned about the side effects that we might feel. With this, please allow me to share a short story of my condition and my experience on the side effect of medicines. I was diagnosed with neurofibromatosis type 1 or NF1. NF1 is a condition commonly associated with multiple cafe au lait spots on the skin. Cafe au lait spots are light brown in color, like the color of coffee with the milk. About 10% to 25% of the general population has cafe au lait spots. NF1 is suspected when a person has 6 or more of it. People affected by NF1 also tend to develop varying neurofibromas, meaning a benign non-cancerous tumors on the covering of the nerves. Neurofibromas are often seen as raised bumps on the skin and can affect a person's appearance. Plexiform neurofibromas, which form under the skin or deeper in the body, are also benign tumors. However, these can grow quite large and can cause significant medical problems affecting the structure of nearby bone, skin, and muscles. When I was diagnosed with neurofibromatosis type 1, one of the doctors noticed that I have a lesion nodules on my left eye. They suggested that I have to undergo a certain procedure whether to determine that we have to remove or not that lesion nodules. Upon agreeing, They applied a certain eye drop on my eyes, on which I felt a flaring pain. When we complained about the pain that I felt, the doctors told us that they didn't expect me to have that kind of reaction since it was just a normal eye drops. Since then, I had a fear of taking any eye drops on my eyes, knowing that neurofibromatosis doesn't have any medication to cure, to prevent, or to stop. There are some studies that coming out right now that there is a certain drug for neurofibromatosis patient, but still the accuracy of the efficacy of this certain drug is still not variable. We're still hoping that there will become a time that neurofibromatosis can be healed. I hope with this, the patient can also be informed that having the side effects of medicines is also important for us. We must also take the consideration of each and every one for this. We must always raise our voice and asking our physicians that every time that they will be giving us a prescription, we have to ask them the full details and explain to us whether they have this medication has a side effect on us. Aside from that, we must also be aware that the physicians can also listen to us. Let us not fear ourselves with telling them and letting them know our fears and our concerns. Thank you everyone, and thank you for the invitations.